Good morning, everyone. Appreciate you guys taking the last day of Gartner to come to our session. Hopefully it'll be an informative one. But it's not lost on us. The last thing between you and your flights or is this presentation. So thanks for joining us.
Or a nap.
Or a nap. Yeah, I could use one. It's been a long few days. So today we're going to talk about our passion at Verato, which is this idea of really what we get every day, focusing on driving exceptional experiences everywhere by solving the problem that drives everything else, knowing who is who. And we think this is really a timely topic as we're all sitting in the room probably thinking a bit about AI and how we get ready for AI and use AI in our enterprises. But also it's a good topic when you start thinking about all the things that you're doing in your enterprises to create a better experience, whether it be for your customers through the customer journeys, in healthcare, the patient journey, or it be your employees and your providers. So, and what our customers are telling Verato is that, foundationally, before they can start thinking about really doing the things they want to do to go drive exceptional experiences, identity is one of those things they have to solve first. So we're going to talk a lot about that today. Yep. And the real concept here is that, we live in a complex digital world where we have silos of data sitting across our enterprises. We like to think of them as systems of record. Maybe it's your ERP or your EHR or your EMR. Systems of engagement, like your CRM systems or systems that you're using to help drive digital front door and experiences with your customers. And then lastly, systems of insight, like your Snowflakes of the world, where you're really driving the views of analytics and insight across that data. And what we're going to talk about today is how if that data stays fragmented at a person level, everything we're going to talk about today is really around this idea of identity as it relates to people. If you don't have a foundational understanding of how that data belongs to a person across those data silos, then it's really difficult to have the foundation that you need to go drive your AI strategy. So that's the topic for today. Joining me, so I'm Clay Ritchie, the CEO of Verato, and joining me today is Todd Crossland and Aaron Meary. Todd, maybe you want to say a few words?
Yep. Thanks for having me on the panel. So Todd Crossland, I'm Global Industry Principal for Healthcare and Life Sciences at Snowflake. Kind of a fun fact right now is we're adding wellness and fitness, so I'm going to make mine the longest title known to man. But I think we're going to go with something like industry principal for human performance or something like that. But we really see the convergence of wearables and what have you. So it's kind of a fun little fact there. But former CIO, former Snowflake customer, been in the industry over 35 years. So I support our sales, marketing teams globally, and our customers and partners like Verato. So
awesome,
pleasure to be here.
Thanks for joining us. Aaron?
Yeah, good morning. Thanks for having me on the panel. Appreciate being here. Aaron Meary, Executive Vice President, Chief Digital Information Officer of Baptist Health. Baptist Health is just north of here. So basically all of northern Florida, all the way to southern Georgia and out towards the Panhandle, if you know the Florida region. We serve probably about 3.5, 4 million covered lives in that entire region and growing. Also that we're one of the largest trading partners of data. So we exchanged 30 million records just last year across the entire Southeast. So Baptist Health's a large hub for data sharing and data interoperability. And again, back to what Clay was saying, identity plays into all of that, including some of the solutions that we are building to benefit the region that we serve. So look forward to chatting about it today.
Awesome. Thanks. So Aaron, I really wanted to start the conversation. So we're going to have a discussion as opposed to, we know you've seen enough slides probably for a lifetime this week. So Aaron, healthcare is an interesting industry. 30% of the world's data is generated by healthcare. Average hospital generates 2 times annually the amount of data that's in the entire Library of Congress.
That's right.
But yet, in healthcare, we don't use a lot of that data to really help drive the care experience and be able to do important analytics in it with applications like Snowflake. When I first met you, 5 years ago, when I joined Verato as a CEO, you gave me a vision for identity in the context of your enterprise. Now you're thinking about data and data transformation and digital transformation. Could you maybe share, what is your vision for identity?
Sure, absolutely. So for me, identity is the bedrock for everything that we're building, whether it's AI or whatever solutions. But let me just give you an analogy or picture in your head, right? Imagine a 3-legged stool, right? People, process, technology, those legs. The seat of that stool, what you sit on, is identity, right? Imagine in healthcare, how many devices, how many patients, how many employees, all the different constructs of things working together to tie in and tie out. Linking that across the entire ecosystem is very important for one reason: patient safety. High quality output of your product, which is, again, that delivery of exceptional world-class care. So for us, understanding everything, identity as an immutable layer to understand what it is, who's working on what devices are attached to what patient, who's walking in my front door. If we don't have accuracy and high fidelity with that, forget it. You're not gonna be able to deliver high quality care, much less do things like automation, AI, and others. Identity is the cornerstone. It's that keystone component of the entire ecosystem and value unlocking.
So, and then, you had an existing IT infrastructure, an architecture diagram, and in there, kind of as you start thinking about digital transformation, thinking about how to get ready for AI, talk a bit about kind of like the legacy solutions that you had there, and then how it made more, you've migrated from those legacy solutions to Snowflake and a Verato type example from a next gen kind of modern infrastructure to help you really have the vision you're talking about.
Absolutely right. So for those of you who know healthcare is steeped in old big iron. That is exactly the way it was built many, many, many years ago from a lot of that was claims processing and others that sort of grew up and they said, oh, we need to be able to track things like quality and patient safety and others. So healthcare has been on a rapid clip of modernization across the entire industry, then fueled further by the federal government many years ago with the meaningful use dollars and stimulus dollars say, okay, hospitals, digitize your records, get off of paper and get off of big iron and go more modular, more cloud-based. At the same token, the industry modernized itself to really adopting more SaaS-based solutions and others. But yet here I am in healthcare still stuck with processes from the 1980s. So we had to quickly up our game to say, what do we want to invest in to make sure we modernize? Now let's enter in Baptist Health. Baptist Health recruited me in 2021 to make sure that we were investing smartly with a new electronic health record and all these other pieces, but more importantly, to get to know the community in a way they hadn't known before. Let me give you an example. One of my first weeks in Florida, I went to basically a user group meeting of a lot of our patients, right? There's patient families and others because we also have a children's hospital. I said, guys, what do you want from Baptist Health? They held up their cell phone and said, get to know me on this, Aaron. Get to know me better here with high resolution. I said, okay. That told me that some of the first building blocks of what we had to tear down old silos and install was more modular, nimble, agile, highly accurate data and data sources. Thus, ergo, comes in Verato from identity, Snowflake from a data EDW, enterprise data warehouse perspective, so I could begin to truly get to know that patient on their smartphone and get to know who they are. Also to that point, once you're able to do that and start unlocking the value stream of what's happening across your enterprise as a CIO, I can see other areas of, oh my goodness, I need to have a better tracking of this. I need a better CMDB. I need a better ITSM tool. I need all these pieces, but all interplayed with that primary key, which is identity. You've got to know what, who, and where you're dealing with things. So at the end of the day, it was a stepwise process. We're still on that transformational journey. We're still investing dollars as most hospitals and healthcare systems are, but we're doing it thoughtfully and we're doing it responsibly. And I think that's where you're seeing the differentiator and people who are winning and vendors who are winning because they're bringing solutions that match what we look for versus some of the legacy solutions which people are migrating away from.
Great. And then, staying on the healthcare point for a second, then we're going to also talk about horizontally, kind of how these problems also are pervasive in other markets. So, Todd, I remember when you and I first met, and we were thinking about this partnership that was going to happen between Verato and Snowflake. This idea of this shared vision that many of our customers had around Customer 360 and how to create that experience that they expected. And in healthcare, I can't tell you how often when I'm speaking with my customers' leadership teams, they're telling me they had a strategic offsite last week, and for the first time now they're able to they use the C word in their enterprise, and the C word being a customer or consumer as opposed to a patient. And like the mandate to start treating us like customers and consumers as opposed to like patients, and market to them differently and build an enterprise go-to-market engine similar to what you might expect in a typical B2C type organization. So, as you're thinking about kind of the healthcare footprint, like where do you see kind of identity? Is your customers are by definition unifying data?
Sure, absolutely.
How does it fit?
Yeah, the way I look at it, I think we all recognize, you probably heard it 100 times here, is that the patients are going to go off on their own and they're going to go and access AI. They're doing it right now. Everyone's diagnosing themselves, and I know that freaks people like Aaron out, right? But it's happening, so we have to recognize that. So it's how do we blend that world of the consumer with the world of healthcare, and what this comes down to me is trust. And so people look at us, and Snowflake had to gain trust, as I was one of our very early customers at Snowflake in healthcare. So it takes years to establish trust. And so that's what Aaron's team is doing with the population and the consumers, of building that trust. And so it all comes down to trust. So it's trusting the fact that people are going to use public models and put all their symptoms out there. For us, what's important is that you trust us, you trust Aaron as patients, as consumers, to bring this data together securely, privately, safely, right? To then run AI and run models and do all of that in this very private, secure environment, so that you can trust us with your data, while at the same time also interfacing with you. And here we go back around to identity. If I work with a lot of health systems, and you've seen a lot of mergers, acquisitions. You have a provider now; it's a payvider, it's a provider and a payer. Guess what? They've got the same patient in just the 3 different entities that merged, and within those entities, you have the same patient in 50 different sources. How are you going to engage that patient and gain trust in that if you don't know who they are? If you cannot identify them clearly from one implementation on the payer side for membership, because also we can bring up the M word. Okay, they're a consumer, they are a patient, and they are a member, right? From the payer perspective. And so I'm super excited, as when Clay and I met, years ago, it was like, this makes sense, right? We need the ability to bring technology like Verato, bring that into Snowflake, because our customers are already bringing in 50 different sources of data into Snowflake and trying to make sense of it. And sure, they can do that from a claims perspective and a population perspective, but in the end, what Aaron wants to do is engage with the patient, right? So we've got to get to that point where we have full confidence that this patient is the same one across these 50 different sources.
Awesome. And then building on that, so there's a book out there called Kill the Clipboard, and many of us in healthcare had the experience. I had one just with my mother-in-law a few weeks ago. She was getting her hip replaced, and she filled out the same information on the 3 different places she had to go as she was kind of throughout her journey throughout the day of getting her hip replaced. And a lot of it comes back to trust, right?
Yes.
It's a great example of trust, right? And then, Aaron, as you're kind of also onboarding a physician and having the trust that you have the right data, so that for credentialing, so that you can get them practicing, at their highest level and generating revenue. Kind of after the fact, as you talked earlier how modernizing your tech stack was important to get there. What are some of the areas that you can point to where that trust was able to be achieved and drive business value for your users?
Yeah, so great question. So a couple of examples, probably applicable, you all will know this. You probably get your annual wellness exams, reminders, flu shots, others, mammography, colonoscopy if you're over 45. All those things are important. Why? Because you have pockets of the region that you're serving as a healthcare entity that probably do not have as much wellness visits as others. They may not have access to healthy food and whatever else. What we're doing now that we have an understanding of where, basically in our zip codes and our geographies of what ailments people have, is targeted campaigns, not just for the, hey, come get your flu shot, but hey, we noticed you live in a zip code that doesn't have fresh produce. Did you know that we're now partnering with Meals on Wheels and others to bring that to you every Tuesday at 9 o'clock in the morning or whatever? So we're starting to target people in a very different way, gaining more trust in the community, making them healthier. Therefore, they don't have to come to Baptist Health as often as not. If you actually go on Netflix and watch a documentary on blue zones, we were the health system that brought blue zones to Jacksonville, focusing on just this. At the end of the day, it is about data and extrapolation of data and understanding what they call social drivers of health data, basically what happens to you in your day-to-day function as a human being and what you may not have clean access to water, electricity, whatever it may be, and how does that health system help you there, as well as when you present for a true ailment of some sort. So it's taking those lessons learned, those wins of identity, and really going to the community. That's number one. Number two example I would give you, you mentioned the provider community. Understanding where our physicians are and where they're going to, particularly in a region like Northeast Florida, which is growing exponentially fast from people moving across the country to Florida, is very, very important. Why? Because we have a couple things to contend with. Number one, you have licensure and regulation. How do you get that physician practicing what we call top of license immediately so they can truly deliver care to the community? Two, you've got your payers. It takes a long time to get credentialed with payers because they got to make sure this is truly Aaron and he's licensed in the state of Florida and doesn't have any criminal convictions, et cetera. Third, the patients. To build that panel, you have to build trust, right? At the end of the day, it's the relationship between the doctor and the patient. How terrible is that if patient Aaron, 2 A's, shows up and you have it as patient Aaron with an E? They're like, dude, you don't know me. I'm not gonna trust you now. You don't even know my name. Those kinds of things are very important because they add up at the end of the day to true world-class care.
Awesome. And then, Todd, so we've been talking a lot about kind of the healthcare kind of consumer experience and how you're building the right digital transformation infrastructure to get there. But we also recognize that, looking across industries, the same challenges exist.
Right.
And a lot of our customers, they'll hire a consulting firm like Deloitte, and they'll come in, they'll do a customer mapping journey. Right? What kind of show me the care experience or the customer experience, each touch point, and how they actually know who the person is, so they can deliver and curate an experience that they at that moment. Where do you see identity playing kind of outside of healthcare into your customer base, and what are some of the high valued use cases that you really see identity kind of being able to turn on and create accelerated value for your customers?
I don't think we've said AI enough, so I guess I'll go ahead and say it some more, right? I'm sure you've never heard this week. But it is that foundation. What I see across the industries and my peers, financial services, media and advertising, you name it, it really comes down to establishing the base in order to activate artificial intelligence use cases with those personas, with a consumer, with a buyer, with a supplier, right? It's identifying any persona, and we look at, obviously very heavy in healthcare, we're looking at the patient, obviously looking at the physician as well. Right. But outside of that, it's not just the consumer, it is the supplier. And what is amazing to me, and what we get to see from a Snowflake perspective, is the experiences that are now being provided by some of the largest financial services companies in the world to the largest media companies, that suddenly now you're activating artificial intelligence in ways that just were not possible before. Mm-hmm. So I think that's kind of the key to it. There are massive numbers of use cases, but just knowing that identity is what keeps that and makes that happen.
Yeah, and one of our, like I say, I believe it's probably one of the largest customers for both of us, Fidelity. Yeah. They came to us as they were readying for the largest transfer of wealth that's going to happen in the history of the United States in the next 10 years, and their need to understand kind of where is that wealth going to be transferred to, and how do I make sure that we're building relationships with those people today, so that they're going to be able to retain and contain that wealth. And they realized that being able to, identity ended up being an absolute foundational element, working also with inside of the Snowflake data to really kind of like understand and predict who those benefactors are, and then start reaching out to them the way they want to be reached out to start building that relationship. Yep.
It's been really awesome to watch, and I get asked all the time, like, CIOs will come to me and say, how do I get started on this? And my main reference is that you can do two things at the same time. Call it walking and chewing gum, whatever you want to call it. But what I'm encouraging our customers to do is to look at their data and identify something which we call as chewing gum. You can bring AI to life on top of your data very, very quickly. Now, you have to be careful with that. You shouldn't make that available to every patient in your health system. Right. That is not a good idea, okay? So when you're chewing gum, don't give it to your patients, okay? However, at the same time, you can do what we call walking. And walking means that you need things like Verato in order to make sure that you know who the heck Aaron is, right? So that may take weeks or months or even a year to do that. And the beauty is that AI is now being deployed all throughout the data pipeline so that you can do data engineering better, you can do coding better, all the things that you're hearing about. And what you end up with is now a beautiful, curated AI experience for the patients. But don't forget about the fact that you can deploy AI to a small number of people and enable them. We, every day, I will tell you flat out, 15% of my job has been replaced by AI inside of Snowflake. 15%, okay? I don't have to answer the questions of, is Snowflake doing X in Y country for use case Z? You know what they do, right? Snowflake uses Snowflake. I know that shocks you, right? So we take all of our information, public case studies, all the private information, all of our presentations are now in Snowflake, And every sales representative, every sales development representative simply asks, is Snowflake doing this in life sciences in Germany? And the answer's there, right? So that used to be 15% of my job, was just simply matchmaking and doing all of that. So that's something that took weeks, maybe a month, in order to get that up and running. And it only gets better over time. So what my encouragement for everybody is that don't think of everything as a walking exercise. There is tremendous value in that, but don't forget about the quick wins. And there are quick wins to be had. So.
Great call out.
Well, this is a good segue into our final kind of segment here of our discussion, which is really turning the table to AI. And, in healthcare, we're seeing, tepidness, right, with respect to adoption of AI.
Yep.
A lot of time being spent on, for example, how to ready for it. But Aaron, as you think about advice to CIOs that are in your industry in healthcare, as they're thinking about kind of where to get started, what are those high-valued use cases where you can crawl, walk, run towards kind of where you're going to deliver that better care and that exceptional experience for your.
Yeah, it's a great call out. It's a great call out, Clay. So let's talk about for a second, why is there a little bit of hesitation when it comes to adopting AI in healthcare? It's not because we don't want to do it. It's because the legal and compliance realm has not caught up from a patient care perspective, right? AKA, if an algorithm tells you XYZ, some image is cancerous and tumorous, and a physician just accepts that on face value, and the patient's like, well, I don't have cancer, what's going on here? Who's liable for that, right? Those kinds of questions are still being answered in a court of law. But there's an entire other domain of healthcare you can go tackle right this very second around payment and operations, right? How do you streamline all the back office bureaucracy when it comes to filling out a claim? You'd be amazed at the niche industry that's around this. But AI is ripe to disrupt that and ensure continuity of care and quickly accelerating value to cash, to be very honest with you. 2, operations. Quickly identifying bottlenecks in your hospital, whether it's just policy searching all the way through, how do I do X, Y, and Z if an accrediting agency shows up or whatever else? Go build those solutions or partner with the right smart solutions to go build that out within your infrastructure. You don't have to be a giant Baptist Health to do that. You can do it as a little guy on the shop, on the street, but you have to have the willingness and the wherewithal to go try it. Third, I would also say this, as a CIO, to begin to explore what other industries are doing. I've been talking to banking, I've been talking to a lot of other groups. What did you do to solve this problem? Because at the end of the day, we've been using the C word, consumers, a lot. Everybody has consumers. They all have similar buying behaviors and buying patterns. So how can I reach out to them? How can I, from my IVR, my integrated voice call center, and all these other components, I have an entire AI bot that patients interact with from our website perspective. How do we make sure it's smarter? How do we make sure that it's more consumer friendly? How do I make sure that really it's not just a B2B or a B2C, it's one day in the future planning for A to A, agent to agent, right? AI to AI, where the patient probably has a personalized AI agent of their own that's going to interact with yours. So really getting those processes hammered down is very, very, very important to get started.
You're shaking your head, Todd.
Oh no, I was just laughing. You talk about AI, talking to AI, and just one of the crazy things that's happening out there is that because I have purview across payers and providers, is currently we have what's known as what I coin battle of the bots right now. Because what's happening is right in the coding space and reimbursement and prior auth and appeals process is that AI is being deployed on both sides. And so today, it's already AI to AI. So it's like already happening, not within an organization necessarily. There is agentic AI that's happening, and that's great. But what's also happening is that I don't think they realize that the AI generated content is now going past across and now is being picked up by AI. So it's already happening, and so it's crazy to watch. I'm hopeful that people are going to take a step back from that and maybe look at prior authorization and be like, maybe that doesn't make sense. And we are starting to see that. And so I think if AI is the process by which we end up with a simpler process, I'm all for it.
Agreed.
Right?
Amen.
So, yeah.
Awesome. And then, not to put you guys on the spot here, like, the one thing, right? Fill in the sentence, right? AI digital transformation will only succeed if what? Like, Aaron, what do you think?
Only succeed if you define the problem statement crystal clear, right? What are you trying to solve? Too many times I'm hearing AI will boil the ocean, solve all the problems in healthcare. Sure, man, whatever. But the reality is you've got to be able to solve that problem statement with crystal clear clarity and then apply AI appropriately.
And Todd?
I think 2 words, courage and humility. I just like you have to have the courage to get out there and try it. But the second part is that you have to be humble enough to know that as you're walking through it, they always say in startup world, fail fast, right? And all these things. Yes, sure, that's fine. But when you're in healthcare and you're failing, that can have, again, talking about as we bridge into the clinical world, like you have to, go forward with a very humble mindset to accept that when you've made a mistake and then pivot from that, but acknowledge it. And it's part of moving forward, right?
Yeah, I'll give you two examples actually. One is a failure and one is a success story. So failure, we thought we could create using AI a better falls prediction model, right? Usually hospitals use what's called a Morse prediction model, which has been around for many, many, many years. We thought we have enough data, enough fidelity of data, we create our own predictive model, meaning that this patient has frailties, they could fall, therefore they could injure themselves. Or a patient falling in a hospital is one of the common ways a patient injures themselves. Okay, what we didn't account for was the variability of like your floor tiles or the elevators that don't sit perfectly level on the floor. So our model kept failing all these variables that we didn't have any control over. So we failed fast. We said, you know what? Let's take it back to the lab. Let's fix it up. Let's start getting more machine learning and other things to figure out all those other variables we didn't realize we were missing. Just because I know really good about the clinical makeup of the patient did not equate to that he or she was more susceptible to falls because the room was old and layout. So that was a fail, but fail fast. We tried. Success story. It's a terrible success, a good success story, but it's a terrible circumstance we had to solve. So right now in Florida, if you don't realize this, Florida is third in the nation for this horrific thing called human trafficking. We're third in the nation. It's terrible. Even worse, Jacksonville sits at the intersection of I-95, goes up the Eastern Corridor, and I-10. So we have a lot of folks that go through Jacksonville, and unfortunately, we're seeing a lot of that at our hospitals. Even worse, pediatric human trafficking. So we started looking in the market when my nurses and doctors came to me and said, Aaron, is there any AI out there that could help us spot a potential victim when they show up in our emergency department? Why? Because a lot of these patients and victims are coached, and that way they don't appear to be having other ailments other than a stomach bug or something else that's going on with them. But really it's a symphony of issues that identifies this patient could be a victim. So we said, okay, let's get together and figure out the process, right? Define the problem statement really clearly. We actually blew out the process and we said, this is machine learning. It's not even a fancy LLM. It's a machine learning algorithm knowing exactly what variables to cue in on. And based upon that, we can then alert. So sure enough, we went live Valentine's Day of 2024. The very next day, a 17-year-old girl walks into one of my freestanding EDs. The algorithm fires. It was a nurse trainee, actually. The algorithm fires for her and she's like, whoa, recuse the patient. Sure enough, she was a victim. Since then, we've saved over 100 kids with this algorithm that we put out there because of what we're able to now look at the data and spot and take these kids out. Not to say our clinicians wouldn't have spotted them with their eyes. Thank you. Wouldn't have spotted their eyeballs, but the reality is that's what AI can do for you. But at the end of the day, these are, again, what we have to do in healthcare. To your point, run and chew gum. You have to be able to take these bets and do things. By the way, with that code, I've now given it to the healthcare industry, and our major electronic health vendors that are out there are actually deploying this across all hospitals, because my philosophy is if I can save 100 and the hospital next door can save 100, think of how much we can put a dent in this industry. But that's the power of AI, and that's the power of taking these bets and making the right incremental process.
Awesome, I love that story. And I remember you first told me that story, you had actually called me up excited about the fact that a lot of that was able to be made happen because of you trusted the identity and
the identity and data.
Being able to map that back to identity and therefore have AI be effective.
And I think in the emergency department, how many people show up, we've never seen them before. Right. Well, we don't know who they are, and much less can we clue in on history. But if I have resolution to it, I can really correlate data quickly around them and say, okay, this is a victim, right? In the case of this, you're being trafficked to help you. I mean, you can't come up with a better use case in what identity is important for.
Awesome. Well, I know we're coming up on our half hour. The summary here is one of the things we really wanted to highlight in this session is that the first things first, and we believe that focusing on data quality, data fidelity, and being able to do that in the context of identity is one of the first areas you want to be thinking about, so that you can have the data, the quality that you're looking for, that you can train your models on and trust, and also really drive all your, not only just AI, but also the digital transformation that's happening in your organization. In our experience, a lot of times the legacy solutions that you have are not going to be sufficient for that. So it's an opportunity for you to think differently outside the box and what's the right reference architecture to go make that work. We're really proud of the work we've done with Snowflake and being an important part of that architecture that helps that helps the value proposition of unifying that data in Snowflake. And then finally, I think the outcomes here at the end of the day are really going to be around how do you then drive that exceptional experience.
Exactly.
I mean, by knowing the person that you're working with and really curating that experience.
It seems so intuitive. I just got to know who I'm working with. I mean, that seems
seems
so difficult to do without the right tools. It really is.
Yes. All right, that is exactly at 0. So thank you all for
Thank you,
joining
guys.
us.
Yes.
Appreciate it.
Thank you.